Hello, greetings to all my viewers and scientists. My name is Lutaaya James Kiganda, and I'm a medical scientist from Uganda. I welcome you to this report to my study. This study was done to determine the local reference values for random blood glucose levels in young adults at Victoria Medical Center in Kampala, Uganda. The background of the study was that clinical chemistry reference ranges vary due to a number of factors like sex, ethnicity, diet, climatic conditions, genetic conditions, geographical location, and the analytical methods used, as well as the sample type used. The aim of this study was to determine the reference ranges for random blood glucose in healthy adults. Before the study was done, there were no locally established reference ranges, and therefore diagnosis was done depending on the reference ranges that are provided from the manufacturers of the test assays used. However, it is important to note that these actually vary from one set of a population to another. It was therefore important to set and find out the local reference ranges for this population. It was also important as a diagnosis tool for the treatment of diabetes within the local population. On top of that, it would actually provide enough information or scientific knowledge for further use by other scientists. And as stated by the International Federation of Clinical Chemistry in 2000, it is important to set local reference ranges as this helps to interpret the locally obtained results. The research questions were, what is the local reference ranges for blood glucose or serum levels? And what is the variation of locally obtained ranges from those borrowed from outside countries? With outside countries, we're talking about the manufacturers of the different test assays that test for serum and blood glucose. In the methods used, this study was a cross-sectional study. The study population included healthy young adults, both male and female, within the ages of 19 and 39. Specimen collection included taking a finger prick and analyzing for capillary blood glucose, and a urine sample was analyzed to test for blood sugar, for urine sugar and ketones. The selection criteria for the study included the inclusion and the exclusion. Under the inclusion, young adults between the ages of 19 and 39 were healthy-looking and did not have a family history of diabetes. They were not pregnant, that's all female, and without glucose or ketones in their urine. If a participant was pregnant or had a family history of diabetes or was diagnosed with glycosuria or ketonuria, was actually excluded from the study. From the results obtained in the study, when we look at the demographics, 142 out of the 288 participants that were registered, which was a population of 49.3%, the participants were actually male. The mean age of the study was 29, and the minimum age was 20 years. The maximum age was 39. Each age group was roughly represented, as we shall see in the results further. Well, this is the distribution of the ages in accordance to the results obtained and in accordance to the population in the study, which were 288 participants. So we can actually see the different ranges of blood glucose from 3.0 to 4.9 mmol per liter, then 5.0 to 6.9 mmol per liter, and 7.0 to 8.9 mmol per liter. So, participants between the ages of 20 and 24, who were actually catered for 87.18%, had their results between 3.0 and 4.9 mmol per liter. And the remainder, who were 12.82%, had their results between 5.0 and 6.9 mmol per liter. Then participants aged between 25 and 25 years had an equal equivalence, with their blood glucose levels ranging between 3.0 to 4.9 millimoles per liter. And then the other 50% had their results between 5.0 and 6.9 mmol per liter respectively. Then when we look at the participants of ages between 30 and 34 years, we had 63.64% of them having their levels between 3.0 and 4.9 mmol per liter, and the rest, who were 36.36%, having their glucose levels between 5.0 and 6.9 mmol per liter. Then when we move to the participants who were 35 to 39 years of age, we have 1.35% having their glucose levels between 3.0 and 4.9 mmol per liter, and then having 44.59% having their glucose levels between 5.0 and 6.9 mmol per liter. Then 54.05% had their glucose levels between 7.0 and 8.9 mmol per liter. This difference recorded in these results was statistically significant, with a p-value of less than 0.05%, which p-value is 0.001, and that is statistically significant. Next, we can look at the distribution. We say that the total number of participants were 288. Then when we look at the distribution table, we will actually see that our results obtained, the reference range obtained in this study was 2.59 to 7.75 mmol per liter. And when we compare this to the World Health Organization, the reference range that was given in 2013 for blood glucose, which was 3.9 to 7.2 mmol per liter, we can see that this result is actually statistically significant, with a p-value of less than 0.05. So the question is, what is the conclusion of all this? We can see that the results obtained in this study differ from those seen in other literatures. This highlighted the relevancy for establishing population-based specific reference ranges as a tool for result interpretation, patient management, and clinical purposes. Because this data got from this research was actually significant, because we saw a deviation from the already results that are obtained and given by the manufacturers and those that we actually got from the local population. I would suggest that in future it is important for each laboratory to set its own reference values for use in clinical diagnosis. When we are to do this, it is also important that a bigger sample should be captured for a reasonable number of study participants, which can be used to generate conclusive reference ranges for the region. When a bigger population is actually captured, then it is actually more empirical that the kind of results that will be obtained will actually depict the actual happenings of the population. That is what I had for you. Thank you so much. I hope you enjoyed this.